Hello, everybody. How's it going? Thank you guys for coming. We're real excited to have you guys here. My name is Paul Beatty, and I want to introduce my colleagues, Dr. Darren Hearn and Dr. DJ Jernigan. And we're part of a group called the Wilderness Physical Therapy Educators. And we have about 55 minutes today or so to talk to you about three basic things. The first thing we want to talk to you about is a little bit about the concept of what is a wilderness physical therapist. The second thing has to do with giving some examples, and that all of us right now are very fortunate in that we're working in that field in various areas in National Park Service or in the U.S. military. And then the third thing will be to kind of open it up and talk to you guys a little bit about ways in which you can become involved. Realizing that what we're doing is sort of two-dimensional in that as physical therapists, we're providing care to, typically right now, to persons who are backcountry professionals and to other EMS professionals, as opposed to providing care to random folks that we run into on the trail, which we can do at sometimes as a Good Samaritan provider. So the first thing I want to do is give a shout out to one of our colleagues and dear friends, Dr. Seth Hawkins, who is a wilderness medicine physician at Wake Forest University. He has a great definition of wilderness medicine in that medical care and problem solving in circumstances where the surrounding environment has more power over your well-being than does the infrastructure of our civilization, which is a great, great overview of what wilderness medicine is, because we're trained to use various equipment, various resources in safe, warm, climate-controlled environments. And when you get into wilderness, obviously you don't have all that, and so it's a whole new kind of dimension. Now, if we look at the physical therapy practice historically, we've had lots of subspecialty groups of PTs who have worked in resource-deprived environments, especially the U.S. military. And Darren is active duty U.S. Army Colonel right now at Fort Bragg, and he'll be telling us about some of the stuff that he's been doing, and has had multiple deployments as a physical therapist. We also have public health service folks that contribute greatly to disasters and humanitarian type missions. And physical therapists have, for many, many years, been practicing in a direct access environment in which they are the point of care, point of contact for people to enter the healthcare system. And this has been done by people in both in orthopedic facilities, backcountry, and in emergency clinics. And interestingly, when we talk about the whole notion of outdoor professionals being high-performance athletes and tactical athletes, we've had a lot of experience as PTs in the area of sports physical therapy, and also in performing arts physical therapy to take care of people who have to be able to go out and perform regardless of circumstance. So it creates kind of a nice milieu of skill sets. And if we look conceptually at what we're talking about as a wilderness physical therapist, this is going to be a person who's got really good physical therapy skills combined with advanced training as a wilderness medic, starting maybe with something as at the level of wilderness first aid, and then progressing to wilderness first responder, and then to wilderness EMT, which is what all we are right now. So we're all in that category, so that we are able to provide both the key PT skills, many of which are very obvious, which would be things like musculoskeletal care, and evaluation, splinting, joint reduction, real careful palpation to identify hard-to-find fractures and stuff like that. And then the other area, of course, which is real obvious, is in the neuro area. We have tons of training in terms of taking care of people who've got peripheral and central nervous system injuries or dysfunction, and the ability to perform a really good neuro exam, a really good cranial nerve exam, a really good sensory exam, cognitive functioning, and all that kind of stuff. What might be less appreciated is that physical therapists also have really good training in the area of vestibular evaluation, which can be a big deal in people who are doing high elevation tasks and climbing and things like that, as well as wound care and burns, the ability to evaluate and treat people with respiratory illnesses and acute dyspnea, and then, of course, transporting patients and communicating with other medical professionals. So you kind of take this and you spin it with advanced first aid skills that you all are very familiar with, in terms of trauma and acute medical care in the backcountry. And then mix that together with backcountry skills to be able to function safely and effectively in a wilderness environment. And just to give you a brief list of some of these backcountry skills, this is the fun part, by the way. This is what we love, and this is what we come out for. But basically, situational awareness. And we talk about wilderness, anything, situational awareness is the number one safety, always, always. And the ability to appreciate that and to understand how that can change over time. And also survival techniques. We teach a lot of stuff, things like basic shelter building, using a poncho or making confabulated shelter out of available materials, fire lighting, how to do things like, for example, take a gauze impregnated dressing, put a little hole in it, pull it out, and that makes a great wick. And then you light that up, and that's a very powerful candle. We'll start a fire in a downpour. We'll start a fire on top of snow. And that's a huge survival saving thing, not to mention it's a good illumination source. And so just things like, snow caves and all that, you guys are pretty familiar with that in this neck of the woods. And putting all that together with trekking skills and safe hiking, safe climbing, safe whitewater, and then the biggie, of course, being land navigation. And land navigation means using a map and using a compass. GPS is great, we love it, and we use it whenever we can, but we don't rely on GPS. That can get us into big trouble. So if the map tells us something's there and the GPS says something different, we typically are going to make that command decision and go with the map and compass. So these are some of the basic skills. Some of the other skills, the ability to communicate with other folks, particularly with EMS folks, with park service individuals that we're working with, and the ability to be able to transfer care appropriate to them and to provide good, appropriate, succinct, meaningful documentation of what's going on. And then the ability to get out of the way and stand by to be a helper when needed, to be able to lead, follow, or get out of the way as indicated. And then finally, the other big backcountry skill would be in the area of telemedicine, which we're doing more and more, and radio communication and using more of the high-tech stuff for communication to find patients, help out in that area, and also to be able to communicate. And of course, as we're all real familiar with, the ability to avoid animal encounters whenever possible and to be able to safely extricate if there is an animal encounter. And so kind of the basic thing. So putting that all together, the good primary PT skill that a person would get at an entry level and multiplied by experience, and then finally the ability to mix that with being a good medic and with being a good wilderness backcountry person. So there's our bear friend right there. So to talk about some of the roles that we're playing these days, and number one would be what all of you guys would do, which is as a good Samaritan bystander. And just yesterday, we had a real good presentation with you guys right here, talking about being bystanders and having a great hike in the Dolomites. And the next thing you know, you're managing a scene and saving someone's life. And so you never know when you're going to have to be a good Samaritan and to be able to function in that area. We also are having more and more folks participating either as volunteers or as professional folks in ski patrol, on expeditions and treks that go out. And then a cool area is in some of the adventure races. And we have a lot of cool things in Colorado and some of these 100K races where people are out for prolonged periods of time and have all kinds of stuff, dehydration and musculoskeletal injuries or hyponatremia, all these things that can happen. And so by planting people in the backcountry strategically, they can help out from a sports medicine perspective and also help out from a wilderness medical care perspective. And then more and more, we have search and rescue, and that's what our next speakers will be talking about in more detail. And then just being members of community emergency response teams. And the last thing I want to talk to you about is kind of as we set the stage for us to talk a bit about our experiences. Along with my wife Karen, who's also a PT, we've had the awesome privilege to participate as backcountry volunteers in National Park for the last couple of years. We had a chance to work with the Jenny Lake Rangers which you guys are probably familiar with, in Grand Teton National Park. It's been fantastic. And so what we do basically is we come in under the auspices of Backcountry Volunteer, and we have the roles and responsibility of that area, which basically is going on patrols every day, which is a pretty cool gig. You know, we get to get up pretty early and get out on the trail and hike, and it's magnificent. And we're equipped when we go out if something does happen. But mostly what we're doing is just hiking and enjoying being there. And then if something does happen, we're available to lend a hand as indicated and as needed. And then the other task that we do is in the afternoons, we will do patient care. And we do patient care either on site, where we might hike in to see, for example, a work crew or a trail crew in the backcountry, and then they'll have various injuries and other problems that we would look at and then be able to provide services and rehab and give advice and stuff like that. And then we also have a functioning clinic, which is in a rescue cache, so it's in a small building, and we have some basic equipment there in which we do standard physical therapy in a direct access environment. So we're real excited about that. And what I want to do now, there's Karen in Grand Teton. So a pretty cool way to spend the summer. We're delighted and privileged to do that. And I want to go ahead now and have DJ come up and talk a bit.
Thanks, Paul. It's my absolute pleasure to be here with you today. Can I see a raise of hands? How many PTA and PT students and just PTs in general are in the room? Outstanding. This is awesome. It's a real pleasure for me to be in front of you today and be around people that have shaped my life in such a grand way. From my mentor, Alex Surfer, who took me under his wing and actually kind of talked me into becoming a physical therapist, because he realized I was just toiling, doing other things, you know. And he's like, I think you would be a good physical therapist, DJ. I'm like, really? What's a physical therapist? and yeah, sure as heck, you know, here I am. I became a PT. I graduated from Idaho State with a bachelor's degree and went away and got a master's degree. And subsequently, I ended up in Lance Taysom's hands and Cammie's, who were instrumental in being the first iteration of education that I received in EMS. And that was a wilderness first responder course. And but I have to go back though, because Alex taught an altitude or mountaineering physiology course that was just, it blew my mind, right? So that was kind of the start of this thing. And then I got into EMS with Lance, and subsequently I became I'm an avid climber, really. I mean, and it's thanks to you, I guess. I guess. But I was quite possessed with being outdoors and climbing in really any fashion that existed, whether it be snow or ice or, you know, just bagging peaks, whatever. And eventually found out that people got paid to climb. And it was an epiphany to me, right? And a friend of ours, we had gone to climb the Grand Teton, just really, you know, really green under the ears, and we got crushed trying to climb the Grand, but we met some climbing rangers. And it was like, well, who are you? You know, what are you doing? And then it was just like, it was me and my climbing partner, he's my best friend. Like, we're gonna become climbing rangers. That is cool, man, right? And sure as heck, we both became climbing rangers. Pretty cool. I mean, I'm an Idaho State grad. We both ran track at Idaho State, and we were climbing rangers together in Grand Teton National Park. He was a ranger for about 5 years, and I was a ranger for 20. My career started at Jenny Lake in 1998, and I retired at the ripe old age of 53 in 2017. I want to just take you through a little bit of my experience and talk about this idea of a physical therapist being embedded in a team, or someone that's maybe outside of the team that's part of it, but you're not necessarily in the field necessarily like I was on this search and rescue team. So I may be back at the base or the cache or whatever, and a resource for folks, okay? One of my big things when I became a member or a part of this particular team with Paul and Darren was it was really important for me as a search and rescue kind of specialist person that, man, we can't be victims. You know, if I'm going to go and try and engage and be a problem solver or a force multiplier, the healthcare person, me, the PT and SAR person, I can't be a victim. So when we go about thinking about educating people about being a wilderness physical therapist, the number one thing is don't be a victim, right? You have to have the skills to be in the austere environment that you plan to go to, right? And I think I do have some insights into some value-added training that anybody in SAR, and certainly anybody that's a physical therapist in SAR, would want to obtain. And so, yeah, I just so happen to be enticed as a human being to like to walk up and climb things, and I just eventually became a physical therapist. And that's kind of my story. That's kind of how it happened. It just evolved serendipitously. I want to point out that I took every one of these pictures, so when the picture was taken, I was actually there. So I'm just saying, just as a qualifier of the kind of crazy things that I like to do. It's a good friend of mine. His name's Drew Hardesty. He skied the Grand that day, and he's on the ski descent of the Grand Teton in this right here. We're going up. My whole evolution as a physical therapist, really, I burned myself out as a bit of a physical therapist in the beginning. I was just super motivated. I rose up the chain. I got really, really a lot of responsibility really, really quick. And I really said, this is not sustainable for me. There's not enough time for me to climb, for one. And I literally, and it was a dubious time because I stayed in contact with Alex, man, and I became a climbing bum kind of, right? And he was really worried about me when I would travel through Pocatello, when he would buy me dinner because I was poor and, you know, living out of a van, you know? Like, I'm worried about you, DJ. You know? So anyway, being a physical therapist actually led me to become a climbing ranger because I was looking for this life balance, okay? And subsequently, I became an educator, a physical therapy educator, and I've been an educator here at ISU for 22 or 3 years in physical therapy, okay? Let's talk about this. So I was a Jenny Lake climbing ranger, and I was a member of the team. So I was an embedded physical therapist in the team, and I treated my fellow climbing rangers when they had ailments. In fact, Davey right here, the guy in the dark shirt, he had a bulging disc in his cervical spine. Man, I treated him all the time. He'd come over all, you know, seized up, and I had a massage table, and I would do some mobilizations and stuff to his spine, work some of the musculature that was being referred to, and it really helped him. Not to mention the keynote speaker for our talk later today in wilderness physical, in the wilderness track, he had shoulder surgery. He'd call me on the radio, D, I'm coming over. Because he was just all locked up. He'd come over and I'd work him over. You know, I would help him. Do some soft tissue mobilization, Codman stuff, you know, typical stuff, but it was a lifeline for him. And so, anyhow, the main gist of this is if we're going to get involved in wilderness, we better be stewards of the wilderness and know how to travel and survive and not become a victim. You know, what would be a scary thing is if you had somebody that wasn't, you know, like a snowmobile driver and really good at it, and they were on the SAR team. I mean, what's going to happen? Well, they're going to get the snow machine stuck, and then we're going to have another rescue on top of the one we're trying to do. That's the bottom gist, is you got to be prudent and very skilled in the environment in which you're going to be providing the physical therapy care. Ooh. And so, yeah, we need to be proficient in the environment we plan to work. What kind of training can a PT obtain that would be of value of someone that was doing wilderness physical therapy? Well, I've got a few things. These are just different certifications and experiences that I have, but one is I'm a wilderness EMT. I started as a woofer, became a wilderness EMT, and I'm a PT. But man, if I was OCS, wilderness first aid, those are my tickets into becoming a wilderness physical therapy practitioner. Rigging for rescue. I've been through rigging for rescue about 15 times. You know, I'm still not very good at it, right? That's why they call me Dr. Bub, right? I'm not the sharpest, I'm not the sharpest tool in the shed. I just happen to be strong like a dump truck, and that's why they like me, right? Not because I was smart. But rigging for rescue is an incredible thing to possess when you're doing technical rescue skills. I was a wildland firefighter. I held a red card for 20 years, and that's actually me short hauling, doing some rescue mitigation in Rocky Mountain National Park, this is a point of interest, but this is Long's Peak. The next day, this is right before the 4th of July weekend, somebody cratered on the other side, and we did a short haul and got a guy that fractured his pelvis off the mountain, which was kind of cool. We're just doing some practice there. Helicopter crew member. Anybody in here a firefighter? Yeah, so I mean, you understand what being a helicopter crew member is. Yeah, so that's a good skill to have, to leverage into becoming a wilderness. Ooh. Oh,
that's spicy.
That was pretty cool.
Yeah.
DJ, want me to move it back for you?
There we go.
I've just got a couple more slides, and I'm sorry, you guys. Yeah, you could become a short haul specialist, and that's something that we did as a rescue ranger in the Tetons. You'd end up like, Peter Pan, and you'd fly into a scene where you maybe no other human would ever want to go, but that's where you ended up, right? And you had to make it happen in that particular scenario, wherever that was, wherever the emergency was happening. And so you can see, you don't want the practitioner to be a victim, right? Mountain weather, that's a good skill to have, especially here in Idaho, right? With big mountains and stuff. Snow and avalanche safety. Don't be a victim. So lower saddle hut, I've done a lot of interventional type things at the lower saddle hut between the Grand and the middle. That's a Grand Teton in the distance. Yeah, wound care. It's just stuff that I've done as a wilderness physical therapist. Wound care, chest PT, sprains and strains, dislocations or relocations. Just functional mobility, moving people around that are hurt badly. Taping and splinting, soft tissue mobilization, STM, stretching. Those are all things that we're really good at. This is my take. I took this picture. We're swinging leads on Prodigal Son in Zion National Park. Potentially getting ready to do a SAR on these people that spent the night. They bit off more than they could chew. Wilderness physical therapy, it's cool. At least these pictures make it look cool. And that's my take on wilderness physical therapy and search and rescue. And I really appreciate this time. And Dee, I'll hand it off to you.
Thanks, brother.
Thank you.
Thanks, sir. All right, guys. I think we have a really cool mix right now in this room. We've got physical therapists, physical therapist assistants, students, and then we've got our EMS brethren. So I kind of want to focus this little last chunk on what I'm talking about on twofold. One, for the physical therapy side of the house is, what does this actually mean to be part of a team as a physical therapist? And I'll do it from the military perspective because that's what I know. And then for our EMS brethren, why should you want the PT to be in on and be part of your team, right? And so I'll try to go into both of those with this little bit of talk, and then we can have a discussion about it afterwards. So I'm going to give you a little bit of information on how the military likes to use physical therapists, because it goes right into treating in austere and wilderness environments. So much so that this has become, through my career, what I know. And so as my career in the military twilights, I was very desperate to find something else, and I was blessed enough to meet these individuals right over here who introduced me to a whole bunch of other folks who like to do business outside, right? And so I feel pretty lucky to do that. This is what I want to talk about here. I'm not going to read it to you. That's kind of dumb. All right. So PTs in the deployed environment. The military started putting physical therapists. So just a little bit of difference on, like, this kind of technical difference on how the military looks at PTs versus how they're looked at in civilian life. Military looks at PTs. In fact, they just designated them as primary care providers for the musculoskeletal system. They also look at them previously, up until this year, as physician extenders for the musculoskeletal system, right? So the ability to diagnose, order imaging, prescribe limited medication, things like that is what we do on the military side. So this is a pic of just outside Jalalabad, Afghanistan, on a trip. So I'll echo DJ's point, like, the military, you are a soldier first, right? So that means that gets at DJ's point about don't be a victim, right? How do you not be a victim when you're deployed? Well, you carry a gun, right? And you know how to shoot them, right? So, like, and you know how to do those type of things as a soldier. And so this is a little team that I met up with down there. That's PT. My travel buddy Merrick was the OT. He was supposed to be staying and taking care of TBI patients on the big fob, we called it. But he didn't like that idea, so we would go around to about 21 different COPs and FOBs throughout eastern Afghanistan, usually via helicopter, sometimes on the road, and treat patients. And that's what we did. At that time, I was not an EMT, but we do TCCC. Most people in the room probably taught that a time or two. And so that's what we do. But our primary goal here is to get around and bring care to the patient where they are, instead of having somebody who got hurt musculoskeletally have to be evacuated, which costs how many helicopters in a deployed environment? 3. 1 to take the patient, 2 to cover the bird that's taking the patient, right? Lots of money, lots of people's lives on the line to evacuate what may not be a deadly injury. So it's a lot easier to put the PT in the bird, one bird, and take the PT there, have them evaluate a few patients, right? So that's just a lot easier, and people with a couple screws loose like myself like to do that, right? So this began back in the early 2000s. Special Operations did it first, and then that caught on, and we did that in the conventional side, and we did that all through the wars. And I did this with some guys last year, right? So this is I really dig doing this stuff, and I think this is an important way to use PTs, right? And it sounds cool, right? But is it actually effective, right? That's the question, right? Like, does this idea actually work? This is a dear friend of mine, Rachel. She's now with the same unit I'm with, and goes out and takes care of guys all the time. This was I believe it was like a New York Times image. They couldn't believe that a PT was out in this podunk little, like, half a shed office that she had in a different place in Afghanistan. Same time I was there back in 12, I believe this was taken. But the short answer is yeah. So I got the stats up there if you want to know more of them. But here's the big deal, man. Like, if you take a PT and you put them out somewhere where they can assess musculoskeletal injury, you got a really good idea of what's going on with that musculoskeletal injury. You can make the decision of, hey, can this person stay and play? Do they need to go? Do they need to be evacuated? If so, how emergent is this musculoskeletal injury really? Right. That's what we bring to the table. What I will say is, and I know this for a fact about Rachel right there. What I will say is, to John's point yesterday, PTs also know how to get the hell out of the way when crap hits the fan, right? So both of us had the experience where we were in treating patients, had flown in to treat patients. Bad stuff starts happening, and then we transition from kind of owning that area and instructing medics on how to do musculoskeletal evaluations, trying to decide if someone needs to be evacuated. And bad stuff started happening, guess who took charge then? The medic, right? They're the head of the table. They're running the show now. They're running they're within 45 seconds of us getting the first casualty in there. My patient's off the table. The trauma patient is on the table, and I'm switching to doing whatever the medic tells me to do, right? Because that's what we're trained to do. So that is why I think for my EMT and paramedic brethren here in this room, that we understand and know our role in place as well, right? And I think that's super important for all of us, you know, especially like students and folks who come in. You get this degree, and you feel a little bit important or something, but you got to understand your role and know your place, right? And if you do that and you know how to follow it, guess what? When the casualties are done, we all take our deep breath, you know, do whatever we do to get away from that situation and go back to treating patients again. Then the roles just change, and that mutual respect has then been earned, right? So I think that's how we go about that, and I think that's what we learned on the military side of the house. So how would I foresee this working? And this is I think the immediate application on the wilderness side in the United States. I just took a picture of, this is San Antonio, just to kind of give this geographical representation of what I would plan. San Antonio is just where their training. And so if we look at San Antonio, we use a military model of how we would array and how we would move a physical therapist around the, quote, battlefield. With our big FOB or our big medical centers right there, you know, right next to the Alamo, let's say. And we have all these little outposts that are all around, just like they would be in Afghanistan for different missions, right? Instead of having somebody get hurt way over here in Lake Hills, and it's a musculoskeletal injury, and you got to make a decision on does that sprained ankle really need to come out? Is that a fractured tibia or not, right? Or, you know, maybe there's 3 patients who got banged up and doing whatever they're doing. You got to make a call on all those people. That's a really expensive call to make, right? If you got a PT right there in the Alamo and they're bouncing around anyway, send the PT out there, let them evaluate that person and make the call, right? That's just value added, right? So where I see we apply this, and we did this to an extent last year up in Oregon and California, and hope to do it again. You never hope for a wildfire, but you understand what I'm saying, right? We hope to, if that happens again, have the opportunity to bring PTs out to fire again. And do the same thing, right? So if there's a fire, anybody wildland fire in here, right? So if there's a fire, you got where your IMT is, and then you're sending folks out, right? So if I got somebody at the big FOB or at the incident command center, right, where you're getting chow and you're coming back to at the end of the night, where you take your briefings in the morning and the evening, if you got a PT there, they can evaluate. Now, I will say wildland firefighters work some of the most horrendous hours I have ever seen, right? But if the PT is there and can see patients when they come back at chow and maybe tape up some stuff before they go out in the morning, it's value added, right? By the way, if they assess them, the default for a wildland fire team is usually to send them into town, which could be an hour or 2 hours away, to get an image, right? If we can make a call and save just a couple images a week, that saves a whole team from being able to not go out, and saves a lot of money for us to not have to pay for that image, right? So that's the most immediate thing that I see on the PT front for immediate application of wilderness physical therapists. But again, if something goes very badly wrong, and I'm on that medical trailer seeing patients for musculoskeletal injuries, if a trauma patient comes in, what do? I step back and let you guys do your job, right? And you just tell me what you need me to do. I'll use my EMT skills to the best of my ability, but then you're in charge, right? So that's the way that I see this kind of thing rolling out. So I think it's a unique solution. I think it does work, or else I wouldn't be up here spouting off about it. But I think it's got to be the right PT with the right training, right? PTs get super motivated, and what I would never want us to do is to be a detriment to a team, right? The team only succeeds if the team is working well and everybody's an asset. So know how you can be the asset, and then train yourself not to be the detriment to the team. Okay. That's what we try to do for physical therapists who are injured. This group that's sitting right over here that I feel blessed to be a part of. We take those PTs who are off the street or maybe operating in the clinic, and then give them the skills over a period of time to be able to operate in these more austere environments. Learn their role in those austere environments, how to take care of emergent situations, and then also how to step back and understand how to take the lead from someone who knows how to take care of the trauma or whatever is in front of them the best way, right? That's what we kind of do as the wilderness physical therapy educators, is take people outside, teach them how to do a PT out of a rucksack, right? So that's what I'll stop right there and see if there's any questions, or we can have a discussion about it. So, yeah. What questions do you have? I'm curious from the EMS providers too. Like, what do you guys think about that? What's your kind of your view on that? So, yeah. Have at it. Yes, sir.
So, this is kind of going back. DJ, did you say you retired in 2017
Yeah.
at 53?
Yeah.
So you're trying to say every time you're 60 years old?
I am.
Oh, crap. No way.
Yeah.
I would never guess
I
that.
turned 60 on Monday.
Yeah.
You look younger.
I told him the same thing
We
this
can sing
morning,
an
so you
happy
got two
birthday if
today.
y'all want.
Yeah.
Thank you.
That blows my mind. I won't guess you're younger.
Well, the thing is, you got to realize I was an educator and a Jenny Lake Ranger, and so I did this 9 months. I had a killer job. I had to interact with young students, and it kept me young. And I went to the Tetons and I ran around the mountains, and so I'm sure that if you looked at my joints, you might not. But on the outside, it kept me young.
All right.
The imaging in the labs may say something different.
Yeah.
Right? Yeah.
Yeah, question back in the back.
Yeah, so say a PT is interested in getting into this field. I've never seen a job listing for a
Great question.
We're working on that.
Yeah.
We're working on
I
that. In
was going
fact,
to get into it.
and in fact, you mind if I?
Yeah,
take
go,
it
go,
easy.
DJ. Yeah.
Danny, what inspired me to get involved was an article that Paul did that made it onto the cover of our national magazine. And it posed this idea of a wilderness physical therapy. I was like, oh my God, I'm that guy. In fact, I was that guy before he was even thinking about probably wilderness physical therapy. And it just so happened that, serendipitously, I ended up possessing all these kind of weird, crazy skills, and I'm a PT. And what it's done is so my relationships in the National Park Service, fire, and search and rescue is kind of, in my mind, it's what spawned the idea of a PT being a value-added, force multiplier person on one of those teams. Now, and that's whether it's a wildland fire team, if you're a hotshot guy, every hotshot crew's got an EMT, often multiple EMTs. I'm going to say they're going to have a PT on it at some point, right?
Yeah,
so
soon.
are smoke
Right.
jumpers. So, there's going to be PTs that are going to infiltrate all of these different job roles on in a firehouse, right? Where you're going to have that daily dose of the PT doing your. Is that how you do it? And so what we're doing is Paul has been embedded now in Grand Teton for a couple of summers as a PT. And Darren, we've done some reconnaissance on a fire. Darren has been on a fire. And the word is getting out. And so, anyhow, that's how it's going to happen, Danny. And I want you to be the next one. I'm being perfectly honest. And I want these young people to be the next ones. Because you're seeing what you're seeing today. You're like, I see a path forward. I know the people to come to. that are going to help grease the skids for me to create a different balance in my life as a physical therapist that I didn't realize actually existed. I didn't realize it existed. It just happened to me, kind of.
You say it's Danny is your name? Yeah. So I would say this, Danny, one of the things that we're working through right now, in fact, I sent an email yesterday to one of the vice presidents of APTA about, is structuring the licensing for this summer to try to get at that, to get at the seasonal wild and fire PT. And so we are working through that challenge right now. We've got a company, a medical contracting company who wants to do that with us, and we're working for. So I think while you can't Google the job right now, you could partner with somebody who is doing medical care on the typical way and say, hey, this is what else I bring to the table. Can we talk about me using those skills? I think within 2 years, what you'll see is you'll have the ability to go in. You'll need to be credentialed in these places as PT, EMT, but that's going to be, I think that's going to be what you'll see over the next couple of years. On the tactical side, I will say this is already happening. I got a guy who's retiring this summer and is starting a company just like that to work in the firehouses and for SWAT and things like that. So I think that's the way you'll start to see. It's going to be small at first. You won't be able to like USA Jobs it. But I think I can almost guarantee that time is coming.
It's going to be an occupational specialist, and you're going to be that person. And it exists in the what's the public health service. I mean, it already exists, but I mean, it's just never been rolled out or presented this way. And we're trying to gather data, right, and support to create it. And it's taking time. It's happening quickly, but it's taking time.
Yeah, the big thing is getting the licensing. Because you don't know what's going to catch on fire where, right? So how do I get it? How do I make it so that I can get a license in that state before I fly into it, right? Because the turnaround time is sometimes 36 to 48 hours. They want you there, right? So how do I make sure that I can call like Wyoming and make sure that Wyoming's not a compact state? So how do I make sure that I can get my license on the way out, right? Like how do I do that? And that's what we're working through this summer, right now, like for the summer. Yeah. Yes, sir.
I'm part of Benton County Search and Rescue. Do we reach out to you guys to find somebody to work with this? Or is it a policy that eventually you will come and ask us if somebody wants to be a part of our team? How's that?
Right. Well, I'm going to say, sorry.
No, do it, Neej.
Well, I'm going to say, I'd talk to Danny. I mean, you want to talk to the local PT that's where you live, and then have them get a hold of us so we can make sure that person has the appropriate training to be a part of your team. So that's the key. It's like we were saying, we don't want our healthcare provider to be a victim. They've got to be an enthusiast, an EMS enthusiast, an outdoor enthusiast for whatever that thing is that you're doing or going to be, providing care for in search and rescue. And so it would be that. And we're working right now in developing a curriculum to substantiate someone's skill and create the insights for them to be a practitioner in the mountains or in an austere environment. I keep saying the mountains because that's just what I do. That's what I like. But does that make sense? It would be a local provider.
Hey, Darren.
Yeah.
So you said you asked earlier how many people were PTs. I'd like to ask of those PTs or assistants, how many have taken Wolfer course?
100%.
A woofer, a wilderness
Yeah.
first aid or wilderness first responder? Cool.
Because to me, that's the answer that's going to really make those
Got it.
It is.
valuable.
It is.
You go to a mountain bike race, you run an aid station.
Exactly.
Right.
So much of what physical therapy does meshes perfect with Wolfer.
It does. I mean, you think about this. Think about this. Like, what if you're a river person? You still got it's an additional value-added person that's going to be on that trip. And anyhow, I mean, Alex Irvo, he did it. He was doing it in the 70s and 80s. Man, he was an exercise physiologist who was a paramedic, and he was, educating people to get into the hills. Because that was his passion. And so it's spawned. It's really interesting. It's super cool that a lot of this, it's kind of boiled up here, right in Pocatello, where we're presenting today, which is really, really a fun thought.
We-
As a group and wilderness physical therapy educators
Right.
is establishing a curriculum to educate physical therapists to, there'll be multi-levels, first wilderness first aid certification, physical therapist
Yeah.
wilderness first responder certification.
You just don't know it.
Yeah,
You'll be
WAT,
involved
yeah.
in it here pretty
Right.
quick.
WAT,
I haven't volunteered you yet,
Yeah.
to be part of the educational process for physical therapists here on campus at some point, like you've done, you did for me back in the day.
Well, like Alex did for us.
Yes,
He
Alex
was-
did for us.
He was teaching us a woofer class, and he didn't know it was a woofer class.
Yeah,
Right.
uh-huh, it's exactly right. And so I see that as being something that's going to be offered potentially as an adjunct for students in any allied health profession.
You started.
Thinking about this from OT, nursing, just in general, this integration of healthcare providers, not just to mention EMTs, into these austere environments.
Let me talk a little bit about, we have about 5 minutes left. So we have a group now, we're working very closely with our producers in the back here and our camera folks. And we're actually going to be unveiling an online curriculum specifically for physical therapists who are interested in wilderness physical therapy. And we have our first module, which hopefully will be available next week. And what this module is a 0.6, it's what, 60-hour total commitment? 6 hours, excuse me. That's a little better, 6-hour total commitment for the first one. And we basically filmed a lengthy video last summer, and then we're using this video to develop vignettes to do different teaching for things like scene safety, primary, secondary exam, patient transport, stabilization, communication, these types of altered mental status. So if anybody's interested, it'll be available next week, hopefully, or the week after. And in 2 weeks. And this will be on the SWEET website. Paul, did you want to mention anything about it, or? Yeah.
We'll probably be doing some marketing on our Facebook page.
Yeah.
When it's released, basically telling you how to register. And then it's going to be an open enrollment course. It's online. And it's all the material that these individuals made. And it's, again, we did do this really great video opening piece for it that we went out to City Creek here in Pocatello and actually did a faux bike accident and an on-scene examination and recovery. Like a little tiny movie.
Yeah. And actually, the Oscars have contacted DJ about this. And
That was a really good patient.
no, he was brilliant. Yeah, it was really good. But anyway, so we're going to hopefully get that going, and then we'll have multiple modules culminating in a wilderness EMT certification that's tailored toward people with the physical therapy training and skills. So, yeah.
Is there a charge for that? Sorry. Is there a charge for that, I assume? or-
Yes,
Yes, okay.
you bet.
And we have a
And it's,
question on deck.
yeah.
So why is it that you're developing a curriculum specific for physical therapy and wilderness medicine when there's NOLS and other
Sure.
Right.
Great question.
Wilderness Medicine Society affiliates that do that already?
Right. It's to tailor it to the particular skills of a PT.
Right.
And it's meant to bring someone into the fold, because there are going to be other topics, like things like joint dislocation and relocation, patient handling, dealing with issues of someone that's in the backcountry that we want to keep. Well, we can't get a genetic ranger. So it would be the extrication things for functional mobility of someone and things of that nature that are going to bring these other topics to the forefront that a physical therapist is really positioned to be good at, and to teach others potentially to be good at it too.
Darren, talk about dry needling and like an
Yeah,
acute
I'd
back
say-
here. Yeah.
Yeah, I'd say too that, sir, well, to answer your question too, sir, I think one of the nice things about doing it this way for the PTs is it also allows them to begin to see and get CME for both things, right? So that as they're learning how to become a wilderness physical therapist or like become a wolfer and things like that, they can actually get the CME to continue their PT license too. So they can begin to see themselves as
Expand
doing
their
both.
Yeah.
scope.
So that's
Talk about
scoping a profession to begin to accept this new sub profession, this new sub part of the profession is very difficult, and I don't think you can do it without doing it specifically geared towards that profession, if that makes sense. Like that's why we want to do it. It's not just to offer and make sure that people can come in and do this job, but so that the profession itself respects that. So.
Right. And so a good example might be what Darren does and did in Afghanistan and is doing in other places these days. Say, for example, you have somebody that comes in and they're in a forward area. They're part of a team. It could be wildfire fighting, or it could be special operations forces, could be other, Jenny Lake Rangers, things like that. And somebody has acute back pain. So this is something that's kind of a tweener as to whether you should evacuate this person or not. They don't have ridiculous signs, but they hurt like crazy and they can't go at this moment. This is sort of bread and butter for physical therapists, because this is kind of our main kind of patient that we're going to see, where we can do treatments little things we can carry on our back, like a little TENS unit or dry needling. We have skills for mobilization, manual therapy, things like that can be done on a thermarest on the side of a mountain. And like Darren, for example, had one that came in, acute back pain. They were set to send her into town to get a CT scan or MRI, which meant a force reduction. Her team would have been in trouble. And not to mention the trauma of driving, a couple hours in a pickup truck and getting bounced around when your back is hurting. He was able to treat her, and then the next day she was able to go. So that's sort of a classic example of bringing that skill set out there. But again, having that person be safe and effective in a wilderness environment, and having that person be a force multiplier if somebody needs an EMT level care, either to be a scene manager or primary care provider, or to assist somebody with a higher skill set like a paramedic or advanced EMT or something like that. So good question though.
Yeah, it's an excellent question.
Yeah.
I've done chest PT at 14,000 feet on the side of Denali on a 30-day patrol. And I've done other physical therapy interventions at 17,000 feet, right? Taping, strapping somebody to get them down the mountain, because I had that skill to be able to employ my physical therapy, not just my EMS skill. And I did it a lot in the Tetons. Virtually every time I handled a patient, I was employing. And it's just an advanced ability to handle people, because that's why I'm trained to handle people, And so that's why I like the spinal mobilization stuff. I dig that stuff, man. You get my hands on somebody. My hands are better than any kind of cervical splint you're going to put on somebody, And so it's just that, and it's a nuanced thing, I guess. But you're exactly right, and that was my thing initially. But we got to teach people to be good EMS providers first, and hopefully they have that passion to be in the outdoors. And then we mate those things together, and then you're going to be like, God, bring the PT this time. We know it's a hind leg. It's a musculoskeletal thing. Call DJ. He's the guy we want for this one.
I think we're out of time here.
If you have a choice.
Just
sorry.
One last thing. Thank you guys again for coming here. It's a real privilege to be here with you guys. And thanks again.
Yeah.
If you get a chance, you can Google us. We have a really cool website. It's called wildernessPTEd.com. So if you just Google Wilderness PT Educators, that'll pop up. And the website's pretty expansive. There's a lot of cool stuff. And all the photos are our own photos. So we didn't copy anything from the internet. I mean, they're all things that were taken primarily by this guy right here. But again, thank you guys, and I really appreciate your participation and interest.
Thank you.
Yeah. And we'll see you all down the trail. Thanks.
Yeah. See you in the mountains.
Right.